Yes.
Yes. I was going to ask about a male's menopause, because he's always saying, you better watch out when you're going to get this age. I was just wondering, how does a man have this like a woman?
A man does have a menopause, no question about it, except it comes in degrees every 10 years, and it's not related to a decline in hormones like in women. Women don't have a menopause sexually, because when they stop making estrogen and their ovaries shrivel, they're still making testosterone. Their libido organ is this little adrenal gland next to the kidney that makes testosterone. So in a female menopause, she doesn't lose her sexual ability. In fact, she improves. Whereas in the male menopause, the hormones are the same, but he's beginning to lose his sexual ability. He can still perform, but he's got to understand it's different.
Where does the sperm go after a vasectomy?
Well, the sperm just stay there, and they die of old age, and they necrose just like a body would, and gradually they're reabsorbed.
Isn't there some new information out about a vasectomy causing hardening of the arteries?
It was a scare that resulted from a study in 5 or 8 monkeys, and careful public health prospective studies, epidemiologic studies, has now really discounted that as being a problem in humans.
So you are saying you don't think it is causal?
Yeah, right.
What about the adults who change their sexual identity in midlife?
Boy, that's a good point. I'm glad because certainly in prisons that happens. The sexual identity hasn't changed. Their imagery in their own mind hasn't changed. It's just that they're now acting out what their imagery originally told them. And in the unusual situation in a prison where a heterosexual man suddenly goes into homosexuality, and then when he leaves the prison, goes back to heterosexuality, we've talked to these prisoners, and what always happens is when they're having homosexual relations, these men are imagining they're having sex with a woman. It is a weird situation in a prison, and it's a substitute for masturbation. But they have not changed their sexual identity or their sexual preference. And when they leave the prison, and women are available, they go back to heterosexuality.
And we'll be back in just a moment. This is the book. It's titled The Male, From Infancy to Old Age. No, you don't have to be in medical school to understand it. Can you make men more sexy by giving them more testosterone?
Well, you know, you really can't. You can, if you give them huge levels of testosterone, you can make them irritable, maybe beef up their sexuality, but the interesting thing is for the average guy walking around the street, his libido isn't related to his level of testosterone as long as it's within a normal envelope range. But if you take a guy that has no testicles and you're giving him testosterone replacements, he's more sensitive to it. And he goes up and down. I mean, when his testosterone level is up because you've given him the shot, you can't control him. He has to have sex 3 times a day. And as the testosterone level goes away, he has hot flashes, he has mood swings, and he's not interested in sex. The average man, it's important to realize that if he's got a little problem with impotence, you are not going to help him by giving him...
A little problem with what?
Impotence. You are not going to help, or a big problem. I'm sorry for that judgmental statement, but a big problem with him is you're not going to help him by giving him shots of testosterone. You're going to frustrate him.
So endocrinology is not the answer for impotence in your view?
No, it is not. As long as you have a certain level above a normal range, you've exceeded the threshold necessary.
How about the woman? Can you make her more interested in sex with more shots of what?
No
Estrogen?
question about it. No, not estrogen. That's the point. If you give her testosterone shots, you can goof up her genitals just terribly and get her periods off and make her infertile and do all that to her, but you will give her a sex drive and a libido, which is very hard to control.
You'll make her a nymphomaniac by giving her a male hormone?
Right.
Yeah.
Well, it sounds like we're getting a lot of sameness no matter what we talk about. We're starting with 2 people that are basically very much the same, and a lot of outside pressures make all of those things very different.
You mean the sexes?
Impotence, and if there's capability of erection, what during the day is it that's disturbing that, or what are we doing to each other that makes those things happen?
Well,
I mean, you know, or it just seems like something outside the body takes that possibility away more times than not.
Oh, in most cases, impotence is because you're distracted and your life is just too cluttered with other things.
What I wanted to understand was when you were talking about the sex offenders and how it shows up within the first 2 years.
No, it doesn't show up. He's saying that he believes the influence in the first 18 months, negative as it may have been, is what will later lead to.
That's what I was wondering. Is it mostly then, do I understand that that's something that they are learned from the way they're raised, or is that something that's just instilled in them, and that's when you would notice
No,
it?
it's not trained in them. It's the way they're raised. A little child raised with violence and lack of love, and the normal attention most of you would give your child, the hugs, the squeezes, changing his diaper. I've often said that if the husband will, or the male, will just change the baby's diaper, that is probably going to go farther towards giving him a happy development than anything else.
So there's a political message here. Those who don't want to be beaten over the head in a dark garage 18 years from now should be trying to figure out how to fix the social environment of young males who may at this moment in infancy be lying unattended with a dirty diaper, watching alcoholism, violence in the home, and perhaps abuse on his own body.
Absolutely. That's where it happens. That's where the violence in our society is beginning, in the first 2 years of life.
Yeah.
What effect does breastfeeding have on the identity sexually?
Well, it really has no bad effect whatsoever or good effect. It's just the good effect. I mean, I happen to believe in breastfeeding. I think it's great for kids. It just makes them feel warm and happy, and it doesn't affect the messages you transmit to the child as to whether he's a boy or girl.
I have 3 boys, and you're making me very nervous about all
Oh, I'm sorry.
I just wondered, many times a woman will follow the same pattern as her mother in her maturity. What chances do boys have the same way? You know, what can I look for, you know, at the same age as their father?
Right. Well, let me first, I don't want you to be nervous about this. This should be, this should help everybody, this new knowledge. One, we should really respect that homosexual men have their sexual preferences, and they are what they are, and that's wonderful for them, and we shouldn't look down on it. But for the suburban housewife, who for the most part doesn't want her little boy to be a homosexual, you should realize he's not going to catch it by having a high school teacher that's homosexual, and you shouldn't worry about that. And if you are worried about it...
That his sexual identity his sexual preference is for all intents and purposes, pardon the cliche, over when?
At 18 months to 24 months of life. And he can't catch a change in sexual preference from society.
Yes.
You said that men change within 10 years, you know.
Every 10 years.
Every 10 years. Okay, I know that Valium or any medications cause impotency. That's got to be a big problem with heart patients.
Well, I think that drugs can have some effect, but I think it's been overrated. It's mostly the constant deterioration in men who are otherwise healthy. You take the healthiest athlete, and you can always see the same effects over every 10 years.
But you don't want to discount alcohol. In fact, there was a study recently.
Right. No, alcoholism and other drug abuse is definitely a cause of impotence, no question about it.
So if you're not having romantic encounters, it may be because he or you or both are drinking too much.
Right, absolutely. Drugs are...
I just want to show, I'm sorry, this is real unfair, but this is fascinating stuff. Roll that film, Ronnie. Show us what we've got here. This is a microscopic film of male sperm.
Now,
That's actually how they look. Look at
These are healthy sperm trying to invade the woman's genital tract, the cervical mucus, at the wrong time of month. There are only 2 days during the entire month when the sperm can actually get in and when the wife can get pregnant. Now, here you see very healthy sperm from a man who's very fertile, and they're trying to get into the woman's cervical mucus, but it's the wrong time of month. And 26 out of 28 days are the wrong time. And no matter how hard they try, no matter how they try to bombard, they simply can't get in. At the right time of month, for 2 days during the month, they'll have an easy time getting in.
Now, in a moment, I think we've got the second... We're almost finished.
And there you can see at the right time of month, they're invading just like an army of ants, so to speak, and they're just crawling up in a straight line with no difficulty, and so just 2 days during the month, the woman can get pregnant.
Does the head of the male sperm rotate 360 degrees?
It sure does. That is part of the homing mechanism. It's really a projectile, and it's able to keep its balance and know where to go by rotating around, much like an arrow.
And how many of those little squigglies are in one ejaculate?
Oh, easily 200 million.
And and we'll be back in just a moment.
Order to Donahue Transcripts, Box 2111, Cincinnati, Ohio 45201. Include the subject or the name of the guest with your request.
The The Male is the title of this book, From Infancy to Old Age. If a man is having to go to the bathroom all night long and it's driving him crazy, you're saying it's probably because his prostate is enlarging.
Right.
And what do you do about it?
Well, it's just a donut hole that has to be scraped out. In the old days...
Services provided and promotional fees paid by the following.
Ever wonder why...